Hey guys, this is Dr. Baker. I am responding to a question from one of my followers who's asking whether cervical myelopathy causes tremor, facial palsy, and stroke-like symptoms. She also added ataxia. So I'll try to break it down. Ataxia is basically having an impaired or a gait or not being able to have balanced walking, feeling unsteady when you walk. So cervical myelopathy can cause that. Cervical myelopathy does not cause facial palsy. And tremor, there's so many different types of tremors. Cervical myelopathy directly does not cause tremor. Stroke-like symptoms, there are a variety of symptoms that manifest as stroke: numbness, tingling, weakness. Now that it can cause, but not your standard typical stroke presentation. Patient who is having facial and hemi-body, half the body numbness, half the body weakness. It does not cause that, because if you think about it, the main signal comes from the brain, goes to the cervical cord, and then goes to the rest of the body. And anything affecting the neck and below, it can be due to cervical myelopathy. Now, there are inflammatory conditions like MS and MS-like diseases that cause inflammation of the cervical spinal cord or thoracic spinal cord that can cause myelopathy. We didn't quite talk about that in my last talk, but it can be a reason for a person who can present with that condition. It's also called de Vick's disease. It's basically a type of autoimmune condition similar to MS, not only affecting the brain, but it can cause the cervical spine and thoracic spine. So hopefully that answers the question. But great question though. Keep those questions coming.